everybody, to another episode of Veterinary Tales, where we dive into the experiences of victims that suffer from the few veterinary bad actors who would rather put money and their pride and ego above the care of their patients. My name is Colleen. I'm one of your hosts, along with the wonderful Mr. Scott Fine. Scott, how are you doing tonight?
Hi, Colleen. Hello.
Hello.
How are you?
Doing good. I like the haircut. It looks good on you.
Well, I don't have much left, but anyway, I got it. Yeah.
Well, we are excited to have the wonderful Marri Perez tonight, who will be joining us and telling us about Pinta's story.
Hello, Marri. How are you?
I'm doing good, Scott. Thank you. How are you?
Good. We go back a little ways, don't we?
Yeah.
Yeah. All right. Well, why don't you start us off by telling us how Pinta came into your life, how long she was with you, and the events that led up to the outcome.
Okay. Pinta got her as a little puppy, actually, from somebody at work who had a litter, and little Jack Russell Terrier. There she is. She's in the sun, so she's got a little face on her. But they had a litter, and so he was giving away the litters, and I took when my kids were begging me, they wanted a dog, and so Mom got them a dog, but she eventually became my doggie, and had her for a long time. She was an awesome dog. She was like one of the family, Scott, you know.
They all are, absolutely.
Yeah. So basically, she, her whole life, we had her till she was 16 years old, and she was diabetic. She became diabetic like at 13 or so, and right away, like that, she the blindness set in. So it was like one followed the other. And she had her vet I used to take her to. He knew her for 15 years. He was a modern day vet. Towards like as she got older, I wasn't really happy with the modern medicine that he was inclined to give her constantly. So I was looking to get a holistic type of, looking around for a holistic type of vet at her age. I just felt that she needed a better way of life instead of all these vaccines, and the rabies shot affected her tremendously. He had on her medical records to give her Benadryl before any rabies shot, and then he would give her the rabies shot along with a bunch of others, and I wasn't aware that just it's not good for her. I learned that like way later, but when she developed the diabetes, I said to him, look, she suffers a lot. She's in a lot of pain when she gets that rabies shot, and it swells up, and she can't move, and she's in a lot of pain. And I said, I just don't want to give it to her anymore. Can we do something? And then he said, well, I can put in and request an exemption in Florida. You can do that based on her health. Her health doesn't permit that anymore. She had a really bad reaction. So for him to have in her medical records, rabies shot, give rabies shot before, give Benadryl before rabies shot, in bold letters, that's how he had it. It was not a good condition. So, and then the Cytopoint, she went with Cytopoint for about a year because she had a lot of allergies. That also occurred later on in her life. So, like I said, he was more into all these new meds that came out, and whenever something new came out, he always urged me, try this, try that, and I always hesitated because I never liked the idea of a new medication without being around for a couple of years, you know, or just to have an idea of how it would affect. Anyway, that's her. So she had a lot of allergies towards the end. Basically, after her 13th year, she developed 12, 13, she developed all these allergies, all at once.
Marri, how much after the diagnosis of diabetes did you notice the blindness setting in?
Oh my God, like he said she's gonna become blind real soon. I would say within months, Scott. It was like really fast. And it was when I took her to an appointment, I think to get her vaccines or something like that. And that's when he noticed that her glucose was off. And he told me, "Oh, we have a bad situation here." And he mentioned, yeah, it's going to be costly, and but it can be treated. It's, you know, it's treatable, if that's the right word for it. But she can still live, but you have to be very careful. And you know, eventually it got to the point where I would monitor before I gave her meals. I would monitor her blood. I did her blood right before she ate to see what her glucose levels was. So I had to take blood and took it from her ear here, and she was really good. She didn't even move or anything. She was so good. But I needed to know the glucose level before she ate, so I knew even I might have to adjust her Vetsolin, her insulin dose, based on how much glucose, because sometimes it would go up, or mostly it would be a little on the high level. He preferred to give her Vetsolin. There was another kind that I was looking into, but she was on Vetsolin for the 2.5 years that she had diabetes.
So when did things start to deteriorate? At what point did you start to notice things happening that eventually led to her passing?
Yeah, well, first I have to point out it, like, she did not eat, and she loved her water, and she was always anxious to eat. When she did not eat on December 25th, I was really surprised, and I took her to the emergency room because one day passed by and she did not eat. And anytime I noticed anything abnormal going on with her, I would take her to the vet, especially because she was diabetic. I didn't wait for any issue to escalate. So I took her to my vet at that point. It was Christmas time, December 25th. So he happened to be on holiday for a week. So I had a animal specialty hospital that he had recommended me to her. And if I can go back to the year of 2018, which is when I became familiar with the Leader Animal Specialty Hospital, because she had a mass on her belly that grew over time. And one day I noticed it was getting hard for her to breathe, and she stopped eating. This is in 2018. But I called the hospital and was given an appointment with a surgeon, Dr. Jason Horgan. He performed the surgery today. He said she needed the surgery today. And I was so grateful that he did not wait, and he performed the surgery, and it was a successful surgery. After that, he literally saved her life. So I became very confident and in that hospital, because my vet recommended. It was a specialty hospital. They were expensive, but they had like all you needed, you know, for whatever, at surgery wise, they had and everything. I mean, they were that's why they were called like a specialty hospital. They had everything you needed, and I would recommend them. I mean, I excuse me, I took Pinta there. Um, she had a little conjunctivitis one time, and I took her there. So as a ER type of thing only, because my vet was closed for that day. And so I would take her there from time to time. So I knew the hospital and I felt comfortable with them. And I really felt like, because of the doctor, like he saved her life really. And I just felt it was a good, solid hospital. So I feel like that's how I have to bring that hospital up. So when she didn't eat, now on December 25th, that's the place I took her because her vet was out of town. And they did a CBC and they told me that she had DKA, small amount of DKA, and that they suggested that to leave her there and she'll be put on IV fluids. So yeah, we left her there. I left her there, and I was just shocked or so surprised when I went there though. Like, it was Christmas time, and most of the cages were full of animals, and I'm thinking, oh, how odd, because it was a spacious, it was a pretty big room. And I noticed one vet there, and then they had like a lot of techs. I didn't count them. I just was surprised to see so many animals. And it was Christmas time. And I later on I realized maybe people just since their own vets go out of town, right? They also board. So they might have brought their pet as a boarding place. But I just know that the nurse was cleaning the cage beneath Pinta's, and she just like was out of breath and appeared tired. It was that busy. So anyway, on Pinta's first day there, I spoke with Dr. Phillips by phone, and he told me all the meds she was getting and what they were for. The next day, he tells me that her glucose is high, which is normal because she is stressed, and she has small amount of ketones. She was not eating, but he was surprised how much she was barking. He said to me she was barking a lot, and he emphasized a lot. That day, they placed the urinary catheter. She barked for 4 straight hours. And I was concerned because I could see she was extremely anxious and agitated. And I asked him to try and give her a tranquilizer to calm her down, because that's what she was doing, barking. But he told me he needed her awake to try to get her to eat, and it would outweigh the benefits if she was sleeping. So I uneasily agreed for 2 days, but she was always barking, like, Scott, whenever I visited her. And then at night when I called the hospital, I would ask, how's she doing? Oh, she's barking, vocalizing, and the girl would laugh, oh, vocalizing. That happened for 3 days. Then the other thing that happened was that I noticed on top of her cage, where her name tag is located, it said diabetic, blind, and deaf in both ears. Now, she definitely was not deaf. That's the one thing that was left to her. She was not deaf. She was blind, and diabetic and elderly. Yeah, 16 years old. So I told the nurse to please correct that because she wasn't deaf. And she said, okay, but she didn't do anything. So my son actually had to have Dr. Phillips come and do it. And he didn't look too pleased to have to do this now. But for me, it was important because Pinta responded when she was talked to. And so we had that corrected.
So, Marri, do you think that was just an accident, an error on their part, or do you think they did that for a particular reason? Did you ever find out anything?
I think it was just an error,
Okay.
truthfully. And I don't know where they got that from, but that's why I wanted it corrected.
Right.
Because she did respond. You would talk to her and she responds to you. So on her second day, I don't know if I mentioned it, they put her on, they put a catheter, urine catheter on her. And then I visited every day and I noticed that the blood had started to collect in the catheter from her constant pacing. And every day thereafter, I asked them to please flush it out whenever I went to visit her until the last day of her life. Every day I would go, blood is in the catheter, and that's because she paced. She would pace when she's in pain. She paces when she's nervous. She's a pacer. And that became really evident as she got older. When she was younger, she was hyper. Jack Russell Terriers are little hyper dogs, but not to this extent. So it just was, she was elderly, and as an elderly dog, that's how she dealt with things. She paced around, so. But let's say, okay, on the third day, I came to visit her and I found her barking, panting, breathing heavily, shaking, and I felt she might have a heart attack. I had never seen her in that condition before. And I asked the nurse to bring her to a private room. It took me like 90 minutes to calm her down because she was shaking like this. And I pet her and talked to her. Then she fell asleep. And they put her back. I told the doctor, please, to give her tranquilizer because this is not good reaction for her to be like this. This is going to affect her electrolytes. Her electrolytes can go up and it could cause a seizure, for one thing. And I told him to please give her tranquilizer. She had been on a tranquilizer recently. Her own vet gave her a tranquilizer because we had moved recently, and she just started kind of going in circles. And so to calm her down, he had just recently put her on a tranquilizer, so it would make her sleep like 3 or 4 hours, and that would be it. It's not like she stayed sleeping all day. And I relayed this to the doctor, and I told him it'll relax her for a few hours, and maybe we can get her to eat this way. So, but he didn't want to do that. This was the third day that I found her, where I told you she was shaking and I had to calm her. Took 90 minutes. The following day, the same thing happened. She was out of breath, barking, panting, shaking. I had the nurse to bring her to a private room. Again, of course, the blood is in the catheter from her pacing throughout the day, back and forth. And the nurse told me, yeah, she does a lot of pacing, and she does a lot of barking. She's not relaxed. She's in a cage, Scott. She's not used to being in a cage. She's blind. She's in a strange location. So yeah, she's going to be doing a lot of pacing. And the nurse put her in a room. I calmed her down. That was day 4. Then and her paperwork, it shows that when they did a change of shifts, she had 2 other doctors tend to her. So they were like the early morning shift doctors, 2 a.m. doctors. So I never was there at 2 a.m. Every time I went to visit her, it was Dr. Phillips. That's who was there, and who I only encountered when I went to see he was there. So on one of the notes in her medical records, it's written, and it's written by him actually, that she has diabetes, some dementia, and anxiety. So it's acknowledged, it's in the medical records. She has anxiety, yet nothing is given to help this anxiety. She ended up being given syringe. She was syringe fed baby food, and I saw she slowly ate through the syringe, but by the next day, that was it. She stopped. Now we're on to December 30th. So she was there 26, 27, 28, 29. This is around December 30th. He mentioned that her ketones were gone. So they did help her and take care of that, but that her electrolytes were out of range. And she still was not eating, nor with the syringe. So, and he was willing, he said, I could take her home the next day. And I said to him, if she's not eating and her electrolytes are elevated, she will die. Her vet is away on vacation for 2 more days, and she'll die at home. And he said, yeah. And so I said, I requested her to let her stay until her vet came back, and he agreed. Then he suggested placing an NG tube. And I felt for the first time kind of optimistic, because I felt maybe it'll help with her electrolytes. All she had was an IV being intravenously, given just fluids, but the NG tube, it's a tube they place in her nose, and it provides nutrition to the stomach. So but I had some concerns, Scott. I had concerns, especially daily concerns, that she wasn't given something to calm her down. Like there were notes written, she has anxiety, and I can understand some barking for 1 or 2 days, but when it reaches the points of tremors, panting, breathing heavily, shaking, you realize this is not a normal condition. She's suffering. This is an elderly blind dog. And all the time, I feel she is treated as a young dog. After she died, I found out that, and I researched the effects of anxiety, the barking, the shaking, the panting, will also affect her glucose and electrolytes and mental condition. And so why allow an elderly dog bark and pace out of the norms? Her glucose levels show high, and it wasn't really under control. It's known that stress is a contributing factor to elevations, and high elevations can also cause seizures. So that's another issue, to have her glucose high. So the main thing is we want to keep her calm, so that everything can flow smoothly and she can get better. Her ketones were under control, but her electrolytes were out now, So they did put in the NG tube, and then he didn't mention to me anything about either a pain medicine or a tranquilizer, and I didn't think of asking him, because the idea, later on I thought, when they insert the tube through her nose, okay, she can experience significant stress and more discomfort, and she'll be trying to pull it out just like she does with her catheter, where every day it's bleeding, it's red, and they have to, you know, remove the blood. Besides the NG tube, she's given 2 other meds. Now, like one of those meds, I later found out is not FDA approved. I've seen reports showing animals have died from this medication. She was given 2 injections of it, one at 4 p.m. and one at 4 a.m. The metronidazole.
Metronidazole. Yeah.
Thank you. I can't
Yeah.
pronounce it.
Yeah.
So twice at 4 a.m. On January 1st, it was 4 a.m. She had a seizure on January 1st. So I feel this medicine should have been discussed with me in detail, because the side effects, and especially that it is not FDA approved, which I would not have approved it. You know, I don't know how her body would react to it, especially in her weakened condition. So that was another thing that happened, that she ended up with a seizure. You know, like.
And was that prescribed by her regular doctor, or was that the overseeing doctor? Like who made that decision?
About what?
Prescribing that medication.
Oh, Dr. Phillips, the usual ER doctor, yeah. And but he explained to me the meds that she had been receiving and what they were for, and actually 2 of the meds that they were giving her has a side effect of appetite that like it doesn't. It's an appetite suppressant to the meds. So, and she wasn't eating. Okay, but he told me that this was needed because when you don't have food in your stomach, it'll create like acid like it does with people. And so this is what they felt, you know, like he explained and he told me, and this is a side effect, and there's really, you know, okay, so I accepted that. But on the other one, he didn't mention anything. He didn't go and explain to me what it was for. Actually, he mentioned mostly the NG tube, and that was it. And he said that you'll benefit to have the NG tube. So that another concern, because I was thinking that since she had the catheter in from day 2, how does one know the actual urine water output versus the blood that was constantly in her catheter, and how would this affect her? Like, was she urinating properly? How do you know how much her urine, because they would measure her urine output. How can you measure her urine output when it's full of blood? Like, and that may also have an effect on her. I don't know, but I just recall how I was shocked to see the ER was pretty full of animals that first day, you know, and throughout her 7-day stay. Then I'm wondering, did they even have an adequate number of medical personnel? I don't know. I only saw one vet in the room, and then just and then techs. I don't know. I never counted. I never, you know, these are just thoughts I later had. Let's just on the 31st, right before she had that seizure, her medical records show a constant barking throughout the day. In fact, it's written 12 times. and panting is written, and her glucose levels show very high levels, and it shows that they gave her Vetsolin, two units, low dose units, and I gave her 5.5 at home. So they were aware of it because they knew how much insulin I give her. She also had fever at 11 a.m. and nothing was given to her for fever nor discussed with me when I arrived to see her. That was on the 31st. Like,
So
they didn't.
obviously, very poor communication between the veterinarian and the parent.
Yes, and it's even in her medical records, nothing it shows fever is written there, but it doesn't show that they gave her anything for it, nor did they even tell me about it. And all I know is that after she had her seizure, January 1st, after the metronidazole was given, she just has a seizure within few hours. So this is January 1st now, 2020, January 1st. At 11 a.m., I received a phone call from Dr. Russell Miller saying Pinta had a seizure and to come quick. So I got there around 12 p.m. It's like a 45-minute drive. We had moved, and so it was just a little bit of a distance. But he gave her an injection of diazepam at 11 a.m. When he called me at 11 a.m., he had just given her diazepam because that's what you do. You give her when she has a seizure, you give her diazepam. That's how they do it. So I got there at 12. She had one dose already. Okay. As soon as I get there, he says to me I should consider putting her to sleep. I didn't understand that. Like, I'm just kind of like walking in and he's telling me I should consider putting her to sleep. After she passed, though, I looked up articles regarding seizures, and they said several seizures in a row, or a seizure that lasts longer than 5 minutes, for instance, is considered an emergency and life-threatening,
Right.
and it requires a trip to the vet. Now, she was already there in the ER. So, but nowhere did it say euthanize after first seizure. And that's what he's telling me, that she needs to be euthanized. He's telling me this, and we're in front of her cage where she's at. She was sleeping because they had given her the diazepam. So all of a sudden he's talking to me about that. And he goes, "Oh, she's having another one." And I didn't see anything like, and then he says it's a focal seizure, a nose twitch. So he pulls a syringe out of his pocket and administers a dose of diazepam. I mean, it's like he had the syringe ready and everything. So I asked him, what can be done besides the diazepam? And he says, nothing. He says, whenever she gets a seizure, we give diazepam. There's nothing else that can be done, and that she is suffering. So I said to him, no, I want to wait and see if her body relaxes and responds with the diazepam. So he leaves, and I'm standing in front of her cage, and really upset, to see her like that. And he's telling me I have to put her to sleep, that that her mind won't be the same. It's affected her mind, and it's like praying, crying, begging for guidance. And I look at my little Pinta and I tell her, this is what it took to get your tranquilizer. The first time I actually see her sleeping peacefully. After a long time, so the doctor comes back and he takes me in a room, and I'm sitting there, and every so often he comes or sends a nurse to see me. And every time he comes, I ask him what else can be done, and he says nothing. He comes back again. I ask, what can be done? Are you sure? There must be something. I don't want to put her to sleep. And I asked so many times, I asked him so many times, there must be something that can be done. Let's wait and see what happens. And then he tells me, you know, there are hospitals that when there's nothing more that can be done, they give the dog to its owner and the owner takes the dog home. And I kind of like just looked at him and he says, but we don't do that here. And I said, is that my mic giving
No,
trouble?
no, no, no,
Oh,
no.
okay. I just said to him, that's a hurtful thing to say. That's not appropriate. And he kind of like semi-acknowledged and looked away. And I just feel like he was rushing me. I don't know. I mean, like if I wanted her to stay some more days, then let it be. I'm paying the bill. They had no trouble with that part. But he kept coming in the room or sending the nurse. Eventually, I believed after several hours that there was nothing else that could be done for her, that she is mentally gone. She will not be the same. He told me this. And like I believed him, you know, when he says, I asked him so many times, what can be done? Nothing, you know, she won't be the same. She's suffering. Um, so I ended up putting her to sleep. And I don't want to get into the details of that
Of course,
because
of course.
it's really painful.
Difficult, of course, understand. Let me ask you, Marri, I'm interested in the attitude or how they treated you after Pinta passed.
Um, they treated me well. He just said, you know, I'm sorry, basically. And I even had wanted to do a necropsy on her because I wanted to see what she passed from, you know, get an idea. And he recommended, he said, no, he advised not to get, saying it wouldn't reveal anything. And then he said, this is January 1st and no one's going to come down. And you know, a lab won't come down on a holiday. But later months, and it wouldn't reveal anything is basically what he said. But months later, I did inquire with the lab, and that they told me that it can always be done. What no one can predetermine what it reveals, and if it's a holiday, what they would do is they would pick up the body the following day, and it would have to be in a frozen state.
Right.
So he told me nothing could be done. My concern is, why is it on the medical records that the time that he put down, he put down 9:17 a.m. Having that he had a discussion with me, that that he discussed with me to correct one of her electrolytes and the potential cause of her seizure versus neoplasia. Now, neoplasia is, you know, this is what he was saying, that she wouldn't be mentally the same. And he had discussed with me that what it could have been that caused a seizure, or was it something in her brain? And that she would need advanced imaging and is not currently stable. Now,
That never happened, right?
not at 9:17 a.m.
Okay.
He had 9:17 a.m. She had her seizure, but it was at 11 a.m. And he has it written in the papers that he had discussed with me about, you know, the potential cause of seizure, and that the patient was suffering and she was getting diazepam and she needs long-acting seizure meds. He also had on the paperwork, he advised either further treatment or humane euthanasia because the patient is suffering. So I don't understand why it's written at 9:17 when he called me at 11 a.m. that same day.
So
There's like,
did any of that conversation ever happen between you and him?
no.
Okay. So he basically lied. He altered the medical records. It's what it sounds like to me.
How many times did I ask him what else can be done?
Right.
I
And he said
sure-
nothing.
And he kept saying nothing.
Right.
Diazepam. Anytime she gets a seizure, we give diazepam. I asked so many times in the 3 hours that I was there, and he kept going in and out of the room, or sending the nurse. I kept saying, what else can be done? Nothing, nothing. He said, nothing. She is suffering. She's mentally, she won't be the same. And yet I didn't know about this medical report until afterwards, that
Right.
this time inconsistency
Right.
was there.
Yeah.
And then the other thing is, like, I had wanted the necropsy done, and he dissuaded me from that, saying it won't reveal anything. And he was like pushing me away from that. And I believed him. I mean, I trusted him. I knew him. He had treated my dog one time when I had to take her to the ER for a little conjunctivitis that she had in her eye. And so he treated her in the ER. And he wasn't a complete stranger. He may not remember that, but I remember him. Like, so I just, like, I don't understand why he was rushing me to euthanize her after having had 2 seizures. I just feel he took away my chance of seeing what was going on with her.
You know,
Because
I don't really ever understand why a veterinarian, other than the obvious reason, would try to discourage a pet parent from having a necropsy performed. It's your money, it's your family member.
exactly.
What is it to them? I mean, what are they afraid of, other than the obvious?
Right, and he
Yeah.
just discouraged me. And
Right.
I looked up, most seizures don't have a detrimental effect on the brain. Now, the nose twitch, when we were standing in front of her cage, and I had walked in, and he said she had a nose twitch. She's having another seizure that it's called a nose twitch, and he gave her the diazepam. I'll tell you, Scott, I was standing right there next to him in front of the cage. I did not see a nose twitch. Now, I'm not a vet. I'm not experienced. You know, he might see the little twitch that I didn't see.
Right.
So I give him the benefit of the doubt for that. But I feel he took away the chance. The diazepam is a tranquilizer,
Right.
first of all. And I feel, had she been left to finally rest, as she so desperately needed, that she would have responded one way or another, and they would notice any abnormalities or whatever else presented itself once she would wake up from the diazepam. So if she had, if what he's telling me, that her brain, she's not the same, you know, because of the seizure had affected her brain and this and that, we would have found out once she woke up. Because first of all, you'll be able to tell if she can pace or do her pacing and her normal activities that she was doing. I mean, it would present itself, we would have found out. So then I'm thinking, I'm thinking, why was she actually given diazepam as soon as she had her first seizure, or was she seizing for minutes before he noticed? And I question that because that nose twitch was so minimal that I didn't see it, that if it's a nose twitch, how would he see it in a room full of other animals? You see what I'm saying?
Of course.
It was, so she could have been seizing, and maybe in his mind, he already knew that that would have affected her brain, is what I'm thinking. And that's why he was ushering me to euthanize her when I first walked in. Like, I don't see any other reason why he would so adamant for me to go ahead and euthanize her.
So, Marri, we're coming up to our time limit. What are your final thoughts?
My final thoughts, I advise people, as their pet gets older, the vets will not treat them as with compassion and extra care that needs to be treated. And if you should see, like, for instance, she's not, they had a ER specialist there. I wasn't aware of it, but to talk to somebody else in the ER department, the head ER person, and have them write down in her medical records what your concern is, because then it brings to focus this issue. And
Okay.
I mean, I have more I could say, but we're running out of time.
Yeah.
And yeah.
Well, you've shown great courage by coming on here and telling Pinta's story. I know it's not easy. It's never easy. 4 years for me, I'd have a hard time doing it. And I know yours is just a year and a half, maybe. Hasn't been as long, but just as painful, clearly. Thank you again for coming on and telling your story. We hope that some of your comments will provide some education for our members and hopefully help them advocate better for their own companion animals. And I've been with you, or you've been with us for a while, and we've had multiple conversations about this. And it's just something that unfortunately happens, and we just want it all to go away. And hopefully one day the incidence of negligence and malpractice will be reduced to the smallest of fractions, if possible. So thanks again, Marri. And
thank you for having me, Scott.
Absolutely.
And I have to give a big shout out to Kim Ann, because I'm like a kindergartner in Zoom classes. Like I told Colleen also, because Kim Ann, she's a music teacher. She's, in our group, and she had put a post up and offered her services for anybody who would be doing Zoom. And she gave me a lot of help initially. So I appreciate that. And a lot of appreciation to Colleen. Her patience went above and beyond. And I appreciate you, Colleen. I appreciate your time that you spent helping me.
It was a pleasure. I love getting to know you. So thank you.
Thank you.
All right. And thanks to everyone else for attending, watching this. And of course, thanks to Colleen, who makes things happen that I couldn't make happen if it took me 100 years to try. So thank you, Colleen.
Well, thank you, Scott. You do all the rest. So it's a pretty easy lift in comparison.
Team effort. All right, everyone. have a good night. We'll see you next time. By the way, next week, Joey's Legacy Roundtable with Carrie Hyde. Guests are Dr. Tara Haddad and our Colorado animal law attorney, Christina Bergston. And we will be presenting a very special Joey Spotlight podcast, which will include 2 attorneys from Hollywood, Florida, who will discuss allegations involving care credit and some unscrupulous vets that are in cahoots, lack of a better term, with them. And regarding predatory lending practices, care credit provides a great service when you're in need, when you're in crisis, but oftentimes there's more to it. So that should be very informative, and we'll keep you posted on the date and the time that we're going to do that. So until next time, see you guys. Take care.
Thanks, everyone.
Bye-bye.
Thank you.
Have a good one.
Thank you.